Welcome to Act Out. I'm Eleanor Goldfield, and this is your tipping point. So, you may have heard the phrase, healthcare is a human right. You may have also heard that neither of the two parties in our oligarchical duopoly think that that is a thing. The Affordable Care Act is neither affordable nor caring, as we covered in episode 84 with activist and Dr. Margaret Flowers. Does that mean that people haven't benefited from some aspects of the ACA? Absolutely not. People with pre-existing conditions, for example, big pharma for another. Think of it this way. It's as if the government has an entire loaf of bread to give out and gives the starving guy a small little corner, and gives the glutton the entire loaf minus that little piece. The glutton then charges the starving guy for the piece that he got from the government, and charges the government for giving him almost the entire loaf. Now, to be fair, the glutton did shove some money into the pockets of government officials to get more of the bread. According to Open Secret's 1,257 unique organizations lobbied for a bigger slice of the ACA loaf, so to speak. Funny how the list is all big pharma and insurance companies, huh? Multi-million-dollar businesses. The sick and poor cannot compete with that, and we don't. The ACA was structured to give us just enough to shut the fuck up while awarding the already grossly rich with more money. Fast forward to today, and we're still paying more for prescription drugs in this country than anywhere else in the world. These are just a few examples. And that includes places with socialized health care. But socialism... We're also paying more for routine medical procedures, not to mention in-depth or life-saving procedures. Want to beat cancer? Well, I hope that you have a house lying around that you're looking to walk away from. In short, that glutton, the pharmaceutical and health insurance industries, they are the big winners in Obamacare, not us. Forcing Americans to buy private insurance plans will obviously benefit the corporations that offer those plans. Striking a deal with Big Pharma dictating that government cannot control prescription med costs will obviously benefit the seller, not the buyer. Now, I'm not here to only shit on the ACA. After all, as I mentioned, I've already done that with the help of Dr. Margaret Flowers in episode 84. What I am here to do is talk about the alternatives. As of now, there are two. One is the GOP alternative to the ACA, which came out last week and is, well, it's what you'd expect and then some. In short, it doesn't so much repeal the ACA, more just make it shittier. Here are a few of the bullet points. Standard & Poor estimates that 6 to 10 million more people would lose health insurance under this Republican plan. 2 to 4 million would lose private insurance, and 4 to 6 million would lose Medicaid. The 400 wealthiest households in America, because of this tax cut, will see annual tax cuts of $7 million per household. The proposal includes a large tax break for insurance companies as well that pay their CEOs over $500,000 per year. It also defunds Planned Parenthood and eliminates abortion coverage. The proposal shifts the age ratio for premiums, allowing insurance companies to charge older Americans up to 5 times as much as young people. Lowers the already low standard of what qualifies as coverage so that health insurers can sell plans that cover less than 60% of covered benefits. You'll still pay a penalty for not having insurance, but this premium won't just go to the insurance companies rather than the government because they need more money. It will also include some very janky math. If in the prior year you had a gap in health insurance coverage of more than 63 days, then when you go back to buy health insurance, you'll pay a premium on top of your premium that will represent 30% more. So that's a lot of fucking math, right? Unnecessary. Wouldn't it be easier if everyone just got free fucking healthcare? As Dr. Margaret Flowers more eloquently put it in a recent article, quote, "Neither the Democrats' ACA nor the Republican American Health Care Act will create meaningful health security for people in the United States. We are already spending enough money on health care to provide comprehensive coverage to every person living in the U.S. without requiring premiums or out-of-pocket costs, such as copays and premiums." And this brings us to the other alternative: National Improved Medicare for All, or single-payer healthcare, or HR 676, or indeed, healthcare is a fucking human right. HR 676 closes the loopholes present in the other two options by providing simple, straightforward coverage for all, from birth to death, including all medically necessary services, from a physical to cancer treatments. This means that the currently 29 million people without health insurance would be covered. And the people who routinely file for bankruptcy due to medical needs, 80% of whom, by the way, have health insurance, they'd still be solvent. People would no longer have to worry about which doctors are in their networks because every doctor would be. And because one of every $3, roughly $350 billion, that we currently spend on healthcare goes to administrators tasked with figuring out this ridiculous web of bullshit that constitutes our Sickcare system, well, we'd actually save money. About $6 trillion over 10 years, that's a lot of money. And as Dr. Flowers pointed out again in episode 84, the jobs lost to this new streamlined structure would be easily rerouted to healthcare jobs that actually serve people's health, not big pharma and insurance companies. In short, HR 676 would save us money and make us healthier. And it would stop that glutton from stealing the whole fucking loaf, to circle back to that metaphor. Now, HR 676 has been introduced in the House, but as with anything else, we cannot leave it up to the asshats in Congress to act in the interest of their constituents. We have to push this. We have to push for this hard. So to learn more about the bill and healthcare for all, visit healthoverprofit.org. The site offers up a wealth of information and stats, like how Medicare for all benefits everyone, from seniors to business owners. Also, go ahead and mark your calendars for April 1st, the March for Health. Although this nationwide initiative falls short of demanding Medicare for all, it does offer up a list of demands that include protecting everyone who is already insured under the ACA and calling for improvements to the ACA as opposed to the devolution. For more info on that and to read the list of demands, go to marchforhealth.org.